My name is Shushila Kumari. My roll number is 85. Today's topic is anti-malarial drugs. Malaria is a protozoal infection which is transmitted to man by the infected female Anopheles mosquito. The species of malarial parasites are Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium falciparum. In India, Plasmodium vivax and Plasmodium falciparum are common. The classification. First is chemical classification. The drug is 4 aminoquinolines. The example is chloroquine, amodiaquine, piperaquine. 8 aminoquinolone, pyramoquine, quinine, methanol, alkaloids, antifolates, antibiotics, hydroxynaphthoquinone. Second is clinical classification. This classification is based on the stage of the parasite they affect. First is tissue schizonticides agents. Second is blood schizonticidial agent. Third is gametocidal agents. The second is based on clinical indications for used clinical utility, which is classified further into drugs used for casual prophylaxis, drugs for suppressive prophylaxis, drugs used for clinical cure, drugs used to prevent relapse. And the fifth one is drug used to prevent the transmission of infection to Anopheles mosquito. This is also called gametocidal drugs. The example is primaquine. The further class is 4 aminoquinolines. The first example is chloroquine. The mechanism of action is chloroquinone is in the acidic vacuole of Plasmodium. Hemoglobin is contains heme, which is toxic, that convert into hemozoin, which is non-toxic. The chloroquinone is a weak base concentrated in acidic vacuoles of parasite, then binds to heme, and then further formation of drug heme complex, which prevents formation of hemojoins, that is damage Plasmodium membrane. Chloroquinone is very effective and rapidly acting blood schizonticides against Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and chloroquinone sensitive strains of Plasmodium falciparum. The pharmacokinetics. Chloroquinone is commonly administered by oral route, but it can also be given by intramuscular and slow IV routes. It is well absorbed after oral and parenteral administrations. It has strong affinity for melanin containing tissue, rapidly distributing to tissue. This is an effective therapeutic plasma concentration. The adverse effect and contraindication. The adverse effect of chloroquinone is may be cause nausea, vomiting, skin rashes, itching, headache, visual disturbance. Parenteral administrations can cause hypotension, confusion, cardiac arrhythmias, convulsion, and even cardiac arrest. This is avoided in epileptic patients. Uses. First use is malaria. The chloroquinone is the drug of choice for the treatment of acute attack of malaria caused by Plasmodium vivax, ovale malariae, and chloroquinone sensitive Plasmodium falciparum. For malaria due to Plasmodium vivax and ovale, primaquine is also administration in addition to chloroquinone. Second, others uses. Malaria, amoebiasis, lepra reaction, rheumatoid arthritis, infectious mononucleosis, autoimmune disorders. Second is amodiquine. It is conjure of chloroquinone. The mechanism of action is similar to chloroquinone. It is an erythrocytic schizontocide used in combination with ACT For the treatment of chloroquinone resistant Plasmodium falciparum, it is not used for prophylaxis of malaria. Piperacin, structurally related to chloroquine. It acts on blood stage of parasite. It has a long duration of action. Second is alkaloids, which contains quinine, quinidine. Mechanism of action similar to chloroquine. Pharmacological actions, antimalarial actions, and GIT is CVS, skeletal muscle, CVS, and local action. Pharmacokinetics, quinine is radially absorbed from the gut or intramuscular sites, extensively metabolized in liver and excreted mainly in urine. Adverse effects, quinine cause dose dependent toxicity, and they are hypoglycemia, hypotension causes, color defects, blur vision, headache, nausea, vomiting, visual disturbance, deafness is also a side effects of quinine. Uses used in malaria. Quinine is effective for treatment of acute attack of chloroquine resistant Plasmodium falciparum. Nocturnal leg cramps. Quinine is not used for chemoprophylaxis of malaria because of its toxicity. Another one is quinoline methanol. Mechanism of action similar to chloroquine and quinine. Pharmacokinetics, mefloquinone is administered orally, is not suitable for parenteral uses because of its local irritant action. Uses, mefloquinone used prophylaxis of chloroquine resistant Plasmodium falciparum, Plasmodium vivax malaria. It is used in combination with artesunate for the treatment of chloroquine resistant Plasmodium falciparum malariae. Adverse effect. These common side effects include nausea, vomiting, diarrhea, dizziness. Regimens for the treatment of malaria. First is treatment of uncomplicated malaria. In the treatment of uncomplicated malaria, for acute attack of Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, chloroquinone sensitive Plasmodium falciparum malariae, gives orochloroquinone is the drug of choice. Chloroquinone 600 mg base stat, 300 mg for second day, 300 mg base third day. For radical cure of Plasmodium vivax, Plasmodium ovale, chloroquinone, quinine plus primaquinine, 15 mg base orally from day 4 daily for 14 days. For chloroquine resistant Plasmodium falciparum infection, ACT regimens for uncomplicated malaria, which contains artesunates 100 mg BD for 3 days, sulfadoxine and primethamine. Second is artesunate plus mefloquinone. Third is artemether plus lumefantrine. Fourth is artesunate plus amodiaquine. Fifth is artesunate plus tetracycline. Sixth is artesunate plus doxycycline. Seventh is artesunate plus clindamycin. Altered to ACT regimens, quinine sulfates with ether, doxycycline, clindamycin. Second is for several or complicated Plasmodium falciparum malaria, is also called cerebral malaria. Parenteral antimalarial should be administered for at least 24 hours once started. Then complete the treatment with full course of oral ACT once the patient is able to talk orally. Then given artesunate dose is 2.4 mg per kg. At 0 hours, repeat at 12 hours and at 24 hours. Alternative to artesunate, quinine dihydroxychloroquine. Patient can take orally 600 mg and given 20 mg per kg. In dilute in 500 ml of 5% dextrose and if used intravenously slowly over 3 to 4 hours. Then artemether on admission 3.2 mg per kg I intramuscular, then once a day 1.6 mg per kg IM till patient can take orally. Then switch over to full course of 3 days oral ACT. Alpha beta artemether 150 mg intramuscular daily for 3 days. Then switch over to 3-day oral ACT when the patient can take orally. Oral ACT, oral medication. C. Treatment of uncomplicated chloroquine resistant Plasmodium falciparum. ACT containing mefloquine should be avoided in cerebral malaria because of risk of neuropsychiatric complications. Supporting measures tepid sponging for fever, sodium bicarbonate to correct acidosis, intravenous diazepam to control convulsion, 10% dextro to combat hypoglycemia, blood transfusion to correct anemia. Thank you.
Alkaloids, quinine and quinidine. Cinchona bark contains several alkaloids of which quinine and quinidine are important. Mechanism of action which is similar to chloroquine. Pharmacological effects. Antimalarial actions. Quinine is highly effective blood sconticide against all the 4 species of Plasmodia. It has gametocidal activity against Plasmodium vivax. It has no activity on hepatic forms. Other actions. First on GIT. Being bitter, quinine reflexes increases gastrin acid secretion. Second, CVS. Quinine directly depresses the myocardium and can cause hypotension, but this effect may not be seen with oral antimalarial doses. Third is skeletal muscle. Quinine directly depresses the skeletal muscle contraction. Response to acetylcholine is also diminished. Symptoms of myasthenia gravis are exaggerated, while symptoms of myotonia congenita are relieved. CNS. In therapeutic doses, quinine often causes disturbance of hearing and vision. It also has mild analgesic and antipyretic effects. Local action. Quinine has local anesthetic effect, but there is invariably an initial irritation. Orally, it causes GI irritation with nausea, vomiting, and abdominal discomfort. Intramuscularly, it causes local pain and necrosis. Next is pharmacokinetics. Quinine is readily absorbed from the GIT or IM site, well distributed in the body, extensively metabolized in the liver and excreted mainly in the urine. Adverse effects are quinine causes dose-dependent toxicities. These are cinchonism, hypoglycemia, and hypotension. Cinchonism comprises of tinnitus, deafness, vomiting. The symptoms are reversible on stoppage of therapy. Hypoglycemia is common with IV quinine, which is due to release of insulin. It is treated with cinchona alkaloids. Quinine is large doses and can cause hypotension, cardiac arrhythmia, and AV block. Black water fever. A hypersensitivity reaction to quinine is characterized by hemolysis and hemoglobinuria, leading to renal failure. Uses. Malaria. Quinine is effective for the treatment of acute attack of chloroquine resistant Plasmodium falciparum malaria. Combination of clindamycin or tetracycline with quinine enhances the antimalarial efficacy of quinine. Second is nocturnal leg cramps. Quinine may be effective in some cases. Quinine is not used for the chemoprophylaxis of the malaria because of its toxicity. Next is the quininol methanol. Mefloquine. It is a synthetic quininol methanol. Like quinine, it is highly effective blood synchronotocide and has no effect on hepatic forms, that is, pre-erythrocytic stages and hypnocytes of Plasmodium vivax. It has no gametocidal activity. Mechanism of action. Similar to chloroquine and quinine. Pharmacokinetics. Mefloquine is administered orally and is not suitable for parenteral use because of its local irritation action. It is well absorbed, well distributed, highly bound to plasma proteins, secreted in bile and undergoes extensive enterohepatic cycling. It is slowly excreted in feces with terminal half-life of about 3 weeks. Uses. Mefloquine is used for prophylaxis of chloroquine-resistant Plasmodium falciparum and Plasmodium vivax malaria. It is used in combination with artesunate for the treatment of chloroquine-resistant Plasmodium falciparum malaria. Adverse effect. The common side effects include the nausea, vomiting, diarrhea, and dizziness. Nausea and vomiting can be minimized by dividing the dose. Neuropsychiatric symptoms and seizures can occur. Mefloquine is contraindicated in patients with the conduction defects, epilepsy, and psychiatric disorder. It is safe for the use in young children. Antifluolettes. These are pyrimethamine, sulfadoxine, sulfones. They are not used as a single agents in malaria owing to rapid development of resistance. Mechanism of action. Plasmodia utilize PABA for the synthesis of folic acid, which in turn necessary for DNA synthesis. Sulfadoxine and dapsone inhibit folate synthetase, where pyrimethamine and proguanil inhibit DHF reductase enzyme of the parasite. Sulfadoxine has a long half-life like pyrimethamine. Combination of the drugs inhibit two successive steps in the folate pathway, which acts faster and produces enhanced antimalarial action. Pyrimethamine. It is a slow-acting blood synchronized and has greater affinity for Plasmodium DHF reductase. The combination of pyrimethamine with sulfadoxine along with the artesunate is used in treatment of chloroquine-resistant Plasmodium falciparum malaria. Pyrimethamine sulfadiazine combination is the treatment of choice for the toxoplasmosis in immunocompromised patients. Pyrimethamine is completely absorbed after oral administration. It binds to the plasma proteins, accumulates in liver, kidney, lung, and the spleen. It has long plasma half-life and is excreted slowly in the urine. Adverse effects are the skin rashes, urticaria, megaloblastic anemia, etc. Next is the proguanil. Proguanil is a prodrug. It has wide margin of safety. It is slow-acting blood synchronized for all the four species of Plasmodia. It also has activity against primary hepatic stages of Plasmodium falciparum. It is absorbed slowly after oral administration, metabolized in liver and excreted in urine. It rarely causes side effects such as nausea, vomiting, diarrhea, abdominal pain, hematuria, and the skin rashes. Next is the hydroxynapthoquinone. Atovaquone. Atovaquone is rapidly acting blood sconticide and is also effective against liver stages of Plasmodium falciparum. It is administered orally. It is highly bound to plasma proteins and excreted changes in feces by the bile. Atovaquone is used with proguanil for prophylaxis of chloroquine-resistant Plasmodium falciparum malaria. It is also effective in the treatment of opportunistic infections with Plasmodium girovaccae and T. gonadie in immunocompromised patients. The common adverse effects include the nausea, vomiting, diarrhea, abdominal pain, skin rashes, headache. It should be avoided in the pregnant woman. Next is the primaquine. It is a synthetic 8-amino quininoline. It is effective against hepatic stages, that is, primary and latent tissue forms of Plasmodium species that infect the man. It also has marked gametocidal activity but is ineffective against erythrocytic form of malaria parasite. The exact mechanism of action of primaquine is unknown. It is almost completely absorbed after oral administration, well distributed, metabolized in liver and excreted slowly in the urine. Primaquine is used for radical cure and terminal prophylaxis of Plasmodium vivax and Plasmodium ovale as it has strong activity against the hypnocytes. For terminal prophylaxis, primaquine 15 mg daily is started shortly before or after return from an endemic area. For radical cure of relapsing malaria, a 2-week course of primaquine is given concurrently with the chloroquine or after the treatment of acute attack. Adverse effects are: this include the nausea, vomiting, epigastric distress can be minimized by taking it with the food. The important side effect with primaquine is hemolytic anemia in people with J6PD deficiency. Methoglobinemia can also occur with primaquine. Primaquine is contraindicated in pregnancy. Next is the tefenoquine. It is a 8-amino quinoline. It is effective against latent tissue forms of Plasmodium vivax. Also has blood scintocidal activity. Has longer duration of action, hence used as a single anti-relapse agent. Next is the anti-artemisinin and its derivatives. Artemisinin is derived from the plant Artemisia annua. The semi-synthetic derivative of artemisinin are dihydroartemisinin, artemether and artesunate. Another compound, arthether, which is developed in India. They are highly effective against erythrocytic stages of all plasmodia. They are highly potent, rapid acting, produce faster clinical cure and parasite clearance than other antimalarials. They also have gametocidal action, reduce transmission of malarial parasite. They also have no effect on hepatic stages on the parasite. Next is the mechanism of action. First, in the acid vacuole of parasite, cleavage of endoperoxide bridge of artemisinin compounds by heme iron. Next, free radical generated, due to which damage to proteins and lipid peroxidation occurs, and last stage is the death of the parasite. Next is the pharmacokinetics. Dihydroartemisinin, which is oral, artesunate oral, IM or rectal, artemether, which is oral or IM, and arthether, which is IM. Artesunate can enhance its own metabolism. The half-life of dihydroartemisinin is about 2 hours. Arthether has a long half-life. Adverse effect: they are generally well tolerated. Artemisinin can cause mild gastrointestinal disturbance, neutropenia, prolongation of the QT interval. Next is the artenolone. It is a synthetic derivative of artemisinin, which acts on erythrocytic stages of the parasite. It is potent, has a rapid onset and short duration of action. A combination of artenolone with piperaquine has been found to be effective and well tolerated for the treatment of Plasmodium falciparum malaria. Next is the uses of artemisinin. Artemisinin is used in the treatment of uncomplicated chloroquine resistant falciparum malaria and severe malaria. Artemisinin has a short half-life and not used for chemoprophylaxis. They should not be used as a monotherapy because of risk development of resistance. They are used in combination with other antimalarials. Artemisinin based combination therapy. The use of ACT improves therapy efficacy, provides faster clinical cure, rapid resistance clearance, prevents resurgence and the development of the resistance. It can be combined with the slowly eliminated antimalarials. Example are mefloquine, lumefantrine, amiodarone, etc. for the treatment of chloroquine resistant falciparum malaria. The treatment for chloroquine resistant falciparum malaria, duration of therapy is 3 days. Artemisinin rapidly kills 90 to 95% of parasite. The remaining parasite are killed by the other drug. The artemisinin derivative can also be combined with doxycycline, tetracycline, clindamycin. Duration of therapy is about 7 days. Recommended ACT regimes for the treatment of uncomplicated Plasmodium falciparum malaria is shown. and several malaria. It is a medical emergency. Patient with severe Plasmodium falciparum malaria may present with one or more of the following features: impaired consciousness, convulsions, prostration, respiratory distress, circulatory collapse, shock, jaundice, pulmonary edema. The main aim of treatment is to prevent mortality. Treatment should be started as early as possible. Artesunate is preferred over quinine for the treatment of severe malaria because the risk of death is lower, it causes rapid parasite clearance, it is safe and well tolerated. It does not require cardiac monitoring. Next is the lumefantrine. It is active against erythrocytic stages of all species of malarial parasite, and fatty meal increases its absorption. It can be gastrointestinal disturbances. It does not significantly prolong QT interval. It is used in the treatment of Plasmodium falciparum malaria in combination with artemether. Next is the antibiotics, which is the tetracycline and the clindamycin. Tetracycline, doxycycline, clindamycin are slow-acting blood sconticides for all species of Plasmodium that infect the man. They do not affect hepatic stages. They are used in the combination with quinine or artesunate for the treatment of Plasmodium falciparum malaria. Doxycycline can also be used along as a chemotherapeutic agent for multi-drug resistant strains of malaria. Tetracycline should not be used in pregnancy and young children less than 8 years. Clindamycin can be used safely in such cases. Thank you.